Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino from ChiroEdge, and welcome to this week's episode of the Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty necessary to change your community from the inside out. So the question today is there an association between birth type and area or presence of musculoskeletal or breastfeeding complaint in the neonate or newborn? The title of the article: Is there an association between birth type and area of musculoskeletal complaint in the neonate? This is from the ECU Convention 2018 Congress Proceedings from Dr. Amy Miller. She said the aim of this study is to gain a more detailed understanding of specific birth interventions in infants with specific musculoskeletal problems and identify any association. That sounds like a great idea. I'm super pumped that we published this because chiropractors are talking about all the time the concept of birth trauma and the first subluxation, specifically how trauma during birth, the more intervention that there is, the more trauma that is present. So, rather than just repeating those words, Dr. Amy is attempting to see if that is actually true. So, Doc, I commend you for that. The researchers looked at an interprofessional breastfeeding clinic. So, everybody in this clinic obviously had difficulty breastfeeding. What they wanted to see was look for associations between specific birth types, feeding difficulties, and musculoskeletal complaints. So we know that everybody there has some sort of breastfeeding or musculoskeletal complaint. So let's go ahead and look at the rates of birth interventions and see how it was associated. So they said that of the 301 infants that presented to this clinic, 83% of these children had intervention at birth. 83%. And that is high. So let's compare that to a normal population. Now, it's a little bit difficult to do this, okay, because rates are going to change by different area. Obviously, if it's one breastfeeding clinic, they're pulling people from one specific area. And the rate of intervention in New Jersey might be different from the rate of intervention directly outside the farm with Anna Mae Gaskin down in Tennessee. But we're going to do our best. Now, we don't know what country they're from either, because it doesn't say specifically, but Dr. Amy, underneath is listed the chiropractic college in the UK, which is called the AECC University College in Bournemouth, UK. Sorry if I'm saying that wrong. And it's at the ECU conference, so let's, for those purposes, just assume that we're looking at the United Kingdom. A quick PubMed search for birth intervention rates yields us a study called Mode of Birth and Medical Interventions Among Women at Low Risk of Complications, a cross-national comparison of birth settings in England and the Netherlands. So this is from 2017. And this is so great. Cool. We got England. We looking specifically at low risk because those interventions are going to be a little bit lower, I would hope. But so let's just use this for comparison. In that study, they mentioned that cesarean rates at highest estimates, they give a range, and it ranges from about 5 to 15%. So let's use 15% for C-section, which is awesome compared to the US, which is 1 in 3 or 33%. Instruments were used at a higher amount, which is ranging from about 7% to 23%. So just for the purposes of just being really quick and easy with this, let's say 15% cesarean. Instruments were used in 23% of cases. Add those all together, we've got 38% of birth intervention, and specifically at this breastfeeding clinic, we're looking at 85%. So you can see this huge gap where in children who have musculoskeletal complaints and breastfeeding issues, there's a really, 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 really high rate of medical intervention, which is our very first thing to make us see or wonder if that intervention in itself is causing and contributing to these issues. So birth intervention is oftentimes used in emergency type situations, not always, unfortunately, or maybe the emergency is presented as such when it's not. And definitely the risk of these interventions, I really don't think is adequately or truly being discussed. We've looked at research out of Denmark that looked at rates of individuals over like a 30-year period who were born via C-section and found increased rates of juvenile rheumatoid arthritis, allergies, asthma, autoimmune issues as well. And I don't think that that's being adequately presented to parents, at least here in New Jersey, because when I mention stuff like that, they look at me like 10 heads, like, isn't C-section supposed to be safer? So this is why education is so important, okay? The most common complaints, feeding complaints that these parents or that these children, I guess their neonates don't really have, but that the families have, let's say, are difficult attachment, pain during feeding, and unilateral feeding preference. If you take care of kids and you know that kiddo is only breastfeeding from one side, I mean, we can pretty much guarantee that there is going to be an upper cervical subluxation there. So they looked at that and they said that the most common areas of, they're just looking at musculoskeletal involvement, and it's chiropractic interns who are looking at this and measuring this as well. So maybe not the highest skill on diagnosis, but we're just going with what we have. And they say that the most common areas of involvement were the thoracic spine, the cervical spine, and the SCM muscle. To get specific, any intervention at all increased the rates of baby being unsettled, as they called it. And this can be any intervention: vacuum, induction, C-section, anything at all. Any intervention increased the risk of baby being unsettled by 62%. Induction increased the rate of specifically the cervical spine involvement by 86%. Emergency C-section had a 71% increased rate of both baby being unsettled during feeding and an upper cervical and a cervical involvement. Vent house birth, aka vacuum extraction, increased the thoracic spine involvement by 34% and unsettled feeding by 38%. Now that was a little bit different for me. Personally, I haven't noticed a change in involvement between C-section and forceps and vacuum, where one of or the other is more likely to cause cervical and the other is more likely to cause thoracic. I'm seeing cervical in all of these, but now that I've read this research, I'm going to go ahead and pay a little bit more attention to that specifically and to see if I can find that actually being the case. And I hope that you do too. Let me know if you guys have an experience similar to this, or if you don't, I'd love to look further into that. Yeah, so that was thoracic spine increased by 34%, unsettled feeding by 38%, and forceps increased the risk of difficulty attaching to the breast by 49%, almost half, and cervical and spine involvement by 30%. So it's pretty clear that the significantly increased rates of musculoskeletal involvement, of difficulty breastfeeding, depending on the type of intervention. That's super, 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 super clear cut. So make sure that during your intake, during your consult, if you have a child who does come in with breastfeeding difficulties, you're asking and finding out about the type of birth and educating mom, dad on that, and letting them know possibly for the future as well these side effects. If you're listening to this podcast, chances are that you do that already. I'm just, bringing it up. If you have somebody who comes in, you know that there's an intervention, ask about breastfeeding issues. See if this holds water for you and for your practice. So the authors say, given these musculoskeletal problems, it may be appropriate that chiropractic care forms part of these infants' health care. Yeah, I'd agree with that. They conclude, infants who undergo assisted birth experience multiple feeding difficulties and multiple areas of musculoskeletal complaint. Forceps and emergency C-section deliveries appear to pose additional risk, and it may be appropriate that chiropractic care is part of routine assessment for these infants. Well, I certainly hope so. I'm handing this information out in the practice. I'm certainly doing my part to help you, or to help my community know the risks, and that chiropractic care should be a crucial part of every infant's care, regardless of birth type, regardless of symptom, regardless of issue. I hope that I am doing my part to help you give out this information and educate parents as well. So, hope you have an amazing day. I hope you're going to go slay some subluxations this week. And I hope that you're going to educate your community. You can allow us to help you by visiting chiroedgemedia.com, and we'll start sending you articles just like this each and every week. Because you, your community, deserve it. And Doc, if you're listening to this, it means you care. And if you care, you deserve the increase in referrals that you'll get. All right, guys, this was Dr. Anthony Pellegrino from ChiroEdge. This was another episode of the Chiropractic Research Breakdown. Go out there, slay some subluxations. I love you all.